For decades, politicians have promised that welfare programs would lift people out of poverty and create a more equitable society. Yet after spending trillions of dollars, poverty rates remain stubbornly high, dependency has increased, and the very people these programs were designed to help often find themselves trapped in cycles of government reliance. The empirical evidence reveals a disturbing truth: the welfare state has become a machine that perpetuates the problems it claims to solve. Through my years studying economic data and observing the real-world consequences of government intervention, I've discovered that well-intentioned welfare policies consistently produce results opposite to their stated goals. The numbers don't lie, and the human cost is devastating. Today, I'll present the hard evidence that exposes the welfare state myth and demonstrate why market-based solutions consistently outperform government programs in actually helping people achieve prosperity and independence. The data we'll examine challenges everything you've been told about government assistance, revealing how free markets provide the most effective path to genuine opportunity and human flourishing. Chapter 1: The False Promise: How Welfare Spending Skyrocketed While Poverty Persisted. Let's start with the most damning evidence against the welfare state. Despite massive increases in spending, poverty rates have remained essentially flat for decades. When President Johnson declared his war on poverty in 1964, the poverty rate stood at approximately 19%. After spending over $22 trillion on various welfare programs through 2020, the official poverty rate hovers around 11 to 13%, but this modest decline occurred primarily in the early years before the welfare state truly expanded. The most revealing period is from 1965 to 1995, when welfare spending increased exponentially while poverty rates stagnated or even increased among certain demographics. Real spending on means-tested welfare programs grew from $75 billion in 1965 to over $75 billion in 1965 to over $75 billion in 1965 to over $400 billion by 1995, adjusted for inflation. Yet poverty rates among African Americans, supposedly a primary beneficiary group, remained stuck around 30% throughout much of this period. Even more troubling is what happened to family structure during this expansion. In 1960, before the Great Society programs took effect, 78% of African American families were headed by married couples. By 1995, this figure had plummeted to just 34%. The correlation between welfare expansion and family breakdown isn't coincidental, it's causal. The data reveals that areas with the most generous welfare benefits often exhibit the highest rates of long-term dependency and the lowest rates of economic mobility. Detroit, which has received billions in various federal programs, saw its population decline from 1.8 million in 1950 to under 700,000 today, with poverty rates remaining among the nation's highest. Compare this to the economic growth periods of the 1960s and 1980s, when job creation and rising wages did more to reduce poverty than any government program. The evidence is clear: economic growth through free markets lifts people out of poverty, welfare programs trap them in it. Chapter 2: The Dependency Trap: How Welfare Incentivizes Poverty. The welfare system's most insidious effect isn't just its failure to reduce poverty, it's how it actively incentivizes behaviors that perpetuate poverty. The empirical evidence reveals a system that punishes work, marriage, and saving while rewarding dependency and family breakdown. Consider the welfare cliff phenomenon, documented extensively in state after state. A single mother with 2 children in many states can receive the equivalent of $35,000 to $35,000 to $35,000 to $50,000 per year in combined benefits, cash assistance, food stamps, housing vouchers, Medicaid, childcare subsidies, and utility assistance. However, if she takes a job paying $40,000 $30,000 annually, she loses most of these benefits, effectively facing a marginal tax rate exceeding 100%. Working more literally makes her poorer. This isn't theoretical, it's documented reality. Studies tracking welfare recipients over time show that those in states with higher benefit levels stay on welfare longer and are less likely to achieve economic independence. The Congressional Budget Office found that reducing welfare benefits by 10% typically increases employment rates among recipients by 5 to 10%. The marriage penalty built into welfare programs is equally destructive. A poor single mother might receive $30,000 worth of benefits, but if she marries a working man earning $30,000 worth of benefits, but if she marries a working man earning $30,000 worth of benefits, but if she marries a working man earning $25,000, they could lose $20,000 in benefits, effectively taxing marriage at punitive rates. The data shows this isn't accidental, it's the predictable result of means testing that considers household income. International comparisons prove this point further. Denmark reformed its welfare system in the 1990s, requiring work or training for benefits and reducing the duration of payments. Employment among former welfare recipients increased by over 30%, and long-term dependency dropped dramatically. Similar reforms in Canada and the Netherlands produced comparable results. The psychological evidence complements the economic data. Longitudinal studies show that long-term welfare recipients experience higher rates of depression, lower self-esteem, and reduced sense of personal agency compared to those who achieve independence through work, even at lower initial income levels. Most tellingly, when welfare reform was implemented in the 1990s, reducing benefits and requiring work, poverty rates declined, employment increased, and child poverty fell to historic lows despite predictions of disaster from welfare advocates. Chapter 3: Education Monopoly: How Public Schools Fail the Poor. Perhaps nowhere is the welfare state's failure more evident than in education, where a government monopoly has condemned millions of poor children to inferior schooling while protecting the interests of bureaucrats and unions over students. The empirical evidence is overwhelming: competition works, monopolies fail, and the children who suffer most are those the system claims to serve. Let's examine the data systematically. Despite per-pupil spending in many urban districts exceeding $20,000 annually, more than most private school charge, academic outcomes remain abysmal. In Detroit, Baltimore, and Washington D.C. District spending among the highest amounts per student. Reading gone with proficiency rates often fall below $20,000 annually, more than most private schools charge, academic outcomes remain abysmal. In Detroit, Baltimore, and Washington, D.C., district spending among the highest amounts per student. Reading and math proficiency rates often fall below 20%. Meanwhile, Catholic schools in these same cities, operating on budgets of $20,000 annually, more than most private school charge, academic outcomes remain abysmal. In Detroit, Baltimore, and Washington, D.C., district spending among the highest amounts per student. Reading gone with proficiency rates often fall below $208,000-$12,000 per student, consistently achieve higher graduation rates and test scores. The international evidence is equally compelling. Countries that introduced school choice programs saw dramatic improvements in student outcomes. Chile's voucher system, implemented in the 1980s, increased enrollment rates from 80% to 95% while improving test scores across all income levels. Sweden's school choice reforms led to improvements in both private and public schools as competition forced all schools to perform better. Most revealing are the natural experiments within the United States. When Hurricane Katrina destroyed New Orleans' public school system in 2005, the city implemented widespread school choice. The results were remarkable. Student achievement increased significantly. Graduation rates rose from 54% to 73%, and the achievement gap between white and black students narrowed substantially. The evidence from existing school choice programs is equally powerful. Students using vouchers in Washington, D.C. showed significant gains in reading achievement, with the largest gains among African American students and those from the lowest income families. Milwaukee's voucher program, studied over 2 decades, demonstrates that students who use vouchers for 4 or more years graduate from high school at rates 7 to 13 percentage points higher than their public school peers. Teacher unions and education bureaucrats consistently oppose these programs, claiming concern for disadvantaged students. Yet the data reveals their true motivation: protecting jobs and power. Public school systems in choice-friendly states have been forced to improve, benefiting all students. Arizona, with extensive school choice options, has seen improvements in both charter and traditional public schools as competition drives innovation. The tragedy isn't just poor academic outcomes, it's trapped potential. Every year the education monopoly continues. Millions of talented children from poor families are denied the same educational opportunities available to wealthy families who can afford private schools or homes in better districts. Chapter 4: Healthcare Havoc. Government Medicine's Fatal Flaws. The welfare state's healthcare programs provide a perfect case study in how government intervention drives up costs, reduces quality, and limits access to the very services it promises to provide. The evidence from Medicare, Medicaid, and international healthcare systems reveals consistent patterns. Government control leads to shortages, rationing, and inferior outcomes. Start with the cost explosion. Medicare and Medicaid were supposed to make healthcare more affordable and accessible. Instead, they've driven costs through the roof. When Medicare launched in 1965, government actuaries projected it would cost $12 billion by 1990. The actual cost was $12 billion by 1990. The actual cost was $12 billion by 1990. The actual cost was $110 billion, nearly 10 times higher. Today, these programs consume over $1.5 trillion annually, crowding out other government spending and requiring massive tax increases. This isn't just about numbers, it's about real consequences. Government price controls in healthcare create shortages and waiting lists. Medicaid's below-market reimbursement rates mean many doctors refuse to see Medicaid patients, creating a two-tiered system where the poor have coverage but limited access to actual care. Studies show Medicaid patients wait longer for appointments, receive fewer services, and often have worse outcomes than even uninsured patients who pay cash. The international evidence is damning. Britain's National Health Service, long celebrated by welfare state advocates, forces patients to wait months for routine procedures and years for elective surgeries. Cancer survival rates in Britain lag significantly behind the United States. Canada's free healthcare system resulted in waiting times averaging 25 weeks for treatment after referral from a general practitioner in 2020. Compare this to market-based systems. Switzerland requires individuals to purchase insurance but maintains a competitive market with price transparency. Result: universal coverage with costs significantly below most other developed nations and superior outcomes. Singapore's mixed system, combining catastrophic insurance with health savings accounts, achieves universal coverage at a fraction of the cost of government-run systems. The American evidence supports market solutions. Direct pay practices, where doctors bypass insurance entirely, offer transparent pricing and often provide better service at lower costs. Surgery centers competing on price have driven down costs for procedures while improving quality. States that expanded Medicaid saw their emergency room usage increase, not decrease, contradicting claims that government insurance reduces inefficient care. Most revealing is what happens when government controls are relaxed. cosmetic surgery and LASIK eye surgery, largely outside government regulation and insurance coverage, have seen dramatic price reductions and quality improvements over decades. These procedures cost less today than 20 years ago while becoming safer and more effective, exactly what economic theory predicts in competitive markets. The COVID-19 pandemic exposed government healthcare's fatal flaws: rigid bureaucracies that couldn't adapt, political decision-making that ignored medical evidence, and centralized control that prevented innovative solutions from emerging. Chapter 5: Housing Disasters: How Government Created the Homelessness Crisis. Government housing policies provide perhaps the clearest example of how welfare state interventions create the very problems they claim to solve. Far from providing affordable housing, rent control, public housing projects, and zoning regulations have systematically destroyed housing markets and created the homelessness crisis plaguing American cities today. The evidence is overwhelming and spans decades. Rent control, implemented in cities like New York and San Francisco with the promise of affordable housing, consistently reduces the supply of rental units while deteriorating existing housing stock. A comprehensive study of rent-controlled cities found that these policies reduced rental housing supply by 15 to 20% over time while increasing rents in non-controlled units. The net effect: higher overall housing costs and reduced availability. Even more damaging are public housing projects, which concentrated poverty and created environments of crime and despair. The data from Chicago's infamous Cabrini Green and Robert Taylor homes reveals the human cost of these experiments. Crime rates in these projects exceeded those in surrounding neighborhoods by 300 to 400%. Educational achievement among children in public housing lagged far behind even other low-income areas. When these projects were finally demolished, former residents who received vouchers to move to mixed-income neighborhoods saw their children's educational outcomes and lifetime earnings improve significantly. The homelessness crisis itself is directly traceable to government intervention. Cities with the most restrictive zoning laws, rent control, and housing regulations have the highest homelessness rates. San Francisco and Los Angeles, despite spending billions on homeless services, see their homeless populations continue growing because they've made it nearly impossible to build new housing through regulatory barriers. Compare this to cities with fewer restrictions. Houston, with minimal zoning and fewer regulatory barriers, has actually reduced its homeless population while maintaining affordable housing costs. The median home price in Houston remains roughly half that of comparable cities in California, despite similar job markets and population growth. International evidence supports market solutions. After World War II, West Germany faced massive housing shortages with millions of refugees and destroyed cities. Rather than implementing rent control and public housing like other European countries, Germany chose market solutions, eliminating rent control, removing building restrictions, and allowing prices to guide construction. Within a decade, Germany had solved its housing crisis. East Germany, using central planning and government housing, struggled with shortages and poor quality housing for 40 years. The voucher system, while imperfect, demonstrates how market mechanisms outperform government provision. Housing voucher recipients generally live in better conditions than public housing residents and show greater residential mobility and life satisfaction. Children and families using vouchers show better educational outcomes than those in traditional public housing. Current data proves the point conclusively. California, with the nation's most extensive tenant protections and housing regulations, has seen its homeless population grow by over 30% in recent years while housing costs have skyrocketed. Texas, with fewer restrictions, has maintained relatively stable housing costs and lower homelessness rates despite massive population growth. Chapter 6: The Charity versus Welfare Evidence: How Private Solutions Outperform Government Programs. The empirical evidence comparing private charity to government welfare reveals a stark truth: voluntary organizations consistently deliver better outcomes at lower costs while preserving human dignity and promoting genuine independence. This isn't ideological preference, it's measurable reality documented across decades of data. Private charitable organizations achieve success rates that dwarf government programs. The Salvation Army's substance abuse programs show completion rates of 70 to 80%, compared to government-run programs averaging 30 to 40%. Catholic Charities job training programs place 85% of graduates in employment within 6 months, while government job training programs struggle to achieve 50% placement rates. These differences aren't marginal, they're transformational. The key difference lies in incentive structures and personal relationships. Private charities must demonstrate results to maintain donor support, creating powerful incentives for effectiveness. Government programs, funded through taxation regardless of outcomes, face no such market discipline. More importantly, private charities can provide individualized attention and moral support that bureaucratic systems cannot match. Historical evidence supports this pattern. Before the welfare state expansion, private mutual aid societies, religious organizations, and fraternal groups provided extensive social services with remarkable effectiveness. African American communities, despite facing severe economic discrimination, developed sophisticated networks of churches, burial societies, and mutual aid organizations that provided both material assistance and pathways to advancement. The data on religious involvement is particularly compelling. Regular church attendance correlates strongly with reduced likelihood of poverty, substance abuse, and family breakdown across all demographic groups. Religious organizations don't just provide material assistance, they provide community, accountability, and meaning that government programs cannot replicate. International comparisons reinforce these findings. Countries with stronger traditions of private charity and social cooperation, like Switzerland and the Netherlands, maintain more effective social safety nets at lower costs than countries relying primarily on government programs. Germany's subsidiary principle, which prioritizes private and local solutions before government intervention, has produced better outcomes than purely state-centered approaches. The efficiency data is equally striking. Administrative costs for private charities typically range from 10 to 20% of total spending, with the remainder going directly to beneficiaries. Government welfare programs often have administrative costs exceeding 50%, with multiple layers of bureaucracy consuming resources that could help the poor. Most importantly, private charity promotes different behaviors in both givers and receivers. Donors to private charities maintain ongoing relationships with causes they support, creating accountability and personal investment. Recipients of private charity report higher levels of dignity and motivation compared to government welfare recipients, according to multiple longitudinal studies. The COVID-19 pandemic provided a natural experiment in charitable versus government responses. Private organizations like food banks, churches, and community groups mobilized immediately to help those in need. Government programs took months to implement and were plagued by fraud, delays, and bureaucratic obstacles. The Paycheck Protection Program alone saw over $100 billion in fraudulent claims, while private charitable giving reached record levels with minimal waste. Modern technology has enhanced private charities' advantages. Online platforms allow donors to support specific individuals or projects, creating transparency and accountability impossible in government programs. Microfinance organizations have lifted millions out of poverty worldwide through market-based approaches that government foreign aid never achieved. Chapter 7: The Path Forward: Market Solutions That Actually Work. The evidence is clear. The welfare state has failed on its own terms while creating massive unintended consequences. But criticism without alternatives is merely complaint. The data shows us exactly what works: market-based solutions that harness competition, Choice, an individual responsibility to achieve the prosperity and opportunity that government programs promise but cannot deliver. Start with the most promising reform, the negative income tax, which I proposed decades ago as a replacement for the existing welfare bureaucracy. Unlike traditional welfare, the negative income tax maintains work incentives by allowing recipients to keep a substantial portion of earnings while reducing benefits gradually. Pilot programs in Seattle, Denver, and Gary, Indiana showed positive results. Work effort declined only minimally while administrative costs dropped dramatically compared to traditional welfare systems. School choice provides the clearest model for reform. Voucher programs consistently improve outcomes for the children who need help most while saving taxpayers money. Arizona's education savings accounts, the most comprehensive choice program in America, allow parents to use state education funds for private schools, tutoring, or homeschooling materials. Results show improved student achievement across all demographics while spending less per pupil than traditional public schools. Healthcare reform must embrace price transparency and competition. Health savings accounts paired with catastrophic insurance create proper incentives for cost-conscious healthcare consumption while protecting against major medical expenses. Singapore's system proves this approach works. Universal coverage with better outcomes at half the per capita cost of America's government-heavy system. Housing solutions require eliminating regulatory barriers that prevent construction and increase costs. Houston's approach, minimal zoning with strong property rights, has maintained affordable housing while other cities spiral into crisis. Japan's flexible zoning laws have kept housing costs stable despite rapid population growth in major cities. The lesson is clear: remove government obstacles and allow markets to provide housing. Tax reform must reduce the penalties on work, saving, and investment that current systems impose. Flat tax systems in countries like Estonia and Hong Kong have produced rapid economic growth while simplifying compliance and reducing corruption. Lower, flatter tax rates increase incentives for productive economic activity while maintaining adequate government revenue. Most importantly, we must recognize that the goal isn't to help government, it's to help people. Market solutions succeed because they align individual incentives with social benefits. When people can profit from solving problems, problems get solved. When bureaucrats face no consequences for failure, problems persist and multiply. The transition path is crucial. Sudden elimination of welfare programs would create humanitarian disasters. Instead, we need gradual reforms that provide choice and alternatives while phasing out failed programs. Allow people to opt out of Social Security in favor of private accounts. Provide vouchers that let welfare recipients choose private job training over government programs. Create health savings accounts as alternatives to Medicaid. The evidence shows that every step toward market solutions improves outcomes while every step toward government control makes problems worse. We have the data, we have successful examples, and we have moral obligations to implement solutions that actually work rather than programs that merely make politicians feel good about themselves. Conclusion. The welfare state myth has persisted for decades despite overwhelming evidence of its failure because it serves the interests of politicians and bureaucrats who benefit from expanded government power. But the human cost is undeniable: millions trapped in dependency, cities devastated by failed policies, and opportunities destroyed by government intervention. The empirical evidence I've presented today isn't partisan politics, it's objective reality. When we compare government programs to market alternatives, the market wins every time on every measure that matters: cost, effectiveness, human dignity, and genuine opportunity for advancement. We face a choice between two visions, one that treats people as helpless victims requiring government care, and another that recognizes human potential and creates conditions for individuals to flourish through their own efforts. The evidence overwhelmingly supports the latter approach. The path forward requires courage to abandon failed policies regardless of good intentions, and wisdom to implement market-based solutions that harness human nature rather than fighting it. Free markets aren't perfect, but they're perfectible through competition and choice. Government programs aren't perfectible, they're permanently flawed by the political incentives that created them. The data doesn't lie. It's time to choose evidence over ideology, results over rhetoric, and freedom over dependency.